Hi, Mike. Hi, Michelle. It's Dr.
Hello.
Ryle. How are you doing?
Doing great.
Can you see and hear me clearly?
Clearly.
Yes.
Good. So, Mike, you come today for your hospital follow-up visit, and you're home now out of your rehab?
Yes.
Okay, and I saw you over in the hospital after your stroke, and I read the discharge summary from the hospital and the discharge summary from the skilled nursing facility. So I understand that you're still left with a little bit of weakness on your right side of your body. Is that correct?
Correct.
But sensation, you can feel normally on the right side. Is that correct as well?
Yeah. Yes.
Have you had any falls since you've been home?
No.
And when you walk, are you walking with a cane or a walker now to help with you?
No.
With your stability? No. So you're just walking without any assist device?
Yes. I did. I used to, but not anymore.
Oh, okay. And you're feeling stable on your feet without that now?
Yes.
Good. I'm glad to hear that. That shows good progress. Are you having any headaches?
No.
How about any blurry vision?
No. My vision is that if I'm looking to the left, I don't move my eyes to the left. I turn my head.
Oh, okay.
The same, my vision is almost directly in front of my eyes. So I can't go like that. If I move my eyes to see, I see double. So if I'm changing my direction, I turn my head.
And I imagine, Mike, that that's going to be really hard on you for driving. Did the doctor say anything about you driving and if they thought that would be safe at all?
I don't drive.
Okay, good. So that must be a big adjustment for you and Michelle, because now Michelle is going to be the caregiver driving you to and from appointments. So I'm really glad that we were able to meet via telehealth and save you all the trip of loading into the car and driving into the office.
Yes, we are too.
Since you've been out of the hospital and you've been home from the skilled nursing facility, have you been having any lightheadedness or dizziness?
Occasionally dizziness, especially first thing in the morning when I get out of bed. At first, I'd get out of bed and stand up and fall down. So figured out that, hey, you can't do that anymore. So now I stand up and look around and make sure I have my vision and balance correct.
Good.
Because the balance was off for a long time too, or I guess it still is.
Sure, that is not uncommon at all after you have a stroke. So I think you're doing really well, and it may take a long, long time for that balance to fully return, if it does at all. Okay, so I want you to be patient. It might be really frustrating to you right now, but it sounds like you're adapting to it, and I'm happy to see that.
Yes, he's adapting really well.
Good. So can you tell me, Mike, are you having any trouble with your memory?
Yes. Yes.
How about your speech? Your speech seems just a little bit slow to me, but I don't know what
It is.
how it was compared to before the stroke. It seemed like I recall that you spoke a little bit faster.
Yes.
So speech is a little bit slow.
I think I did.
Yes. Yeah. It's a good observation.
Now it seems like I almost think about what I'm going to say before I say it. So
Okay.
I'm like right now, I'm instead of just speaking, I think about what I want to impart to you and then say it.
That is how I am when I'm speaking in Spanish.
Exactly.
So
very-
I'm thinking of the words before
Yes.
I'm speaking them.
Yes.
All right. Mike, do you have any concerns since you've been home from the hospital?
No.
Were you able to get all your medications filled at the pharmacy?
Yes.
And you understood what all of them were for? I know my nurse had called you and reconciled your medication list to make sure we know what you're taking and you're taking what we think you are.
Yes.
And you're taking them every day?
Yes.
Yes.
How are you remembering to take those? Do you have a pill box?
I have a pill box that has a week's worth in it, and if I wake up in the morning and can't remember what day it is, I have my little calendar thing in my pocket,
And there's me.
and Michelle to say, what day is this? And I take the pills just before bedtime, so it's the last thing that I do at night, and little pill box by day, so it's worked out so far.
Good. I like the pill box. It seems like that is a good solution for you.
Yes, and this little thing's a great solution too.
Oh yeah, you can set a reminder on your phone.
No, I don't put a reminder, but I frequently press the button to what day is it? Because
Oh, I do that too.
during the day
have
I
the day-
sometimes, what day is this? And so I push the button. It's Tuesday. Okay.
Good.
He's pretty resourceful.
I like that. So Mike, before I move on to physical exam, I would like to ask Michelle if she has any concerns. Is that okay with you?
Of course.
Michelle, how do you think he's been doing?
I think he's been, we've never been in a stroke situation before, but he seems to be doing pretty well. I do worry a little bit about the balance and that kind of stuff, but I think considering that he's recovered pretty well. So we're one step at a time.
Good. All right, so now, Mike, I would like to move on to your physical exam.
Okay.
I know that Michelle is going to help us.
Okay.
I haven't examined you since you've gotten out of rehab. So what we're going to do is we're going to check all the nerves in your face, and then we're going to check some strength in your muscles. I'm going to watch you walk, and then we're going to check some sensation, because I understand that you're weak on that right side, but you still have sensation. Is that correct?
Yes.
First, what I want to do is I want to start with what's called a cranial nerve exam, and this will require you to take off your glasses and for us to zoom in on your eyes and for Michelle to look at your pupils and to shine a flashlight in one
I've
of your
got my
eyes.
hearing aids in. Does that matter?
Nope, that shouldn't matter.
Would you like for me to use the flashlight on his phone?
That would be great. So Michelle, I don't know that I'm going to be able to see his pupils. Those are the little black circles right in the middle of the eyes. So if you can see them, will you tell me if they look like they are the same size?
Okay, right now, they look the same.
Okay, so I want you to take the flashlight and I just want you to shine it into one eye. So I want you to sort of swing it up from the side and shine it in one eye. And what did that pupil do?
Nothing. Maybe a tiny bit bigger. Yeah, they're getting a little bit bigger. But not much change.
Okay, so we expect when you shine a light straight in the eye for the pupil to get smaller.
Okay.
And if you'll look at the other pupil, the other eye, it will often get smaller at the same time. So it's a little reflex where they both constrict.
I guess that's what they're doing.
And it might be hard to tell with the room so bright.
Yeah, I think that's what's going on.
All right, let's go ahead and move on. Now, Mike, did that hurt your eyes at all when she was shining the light into them?
No.
Okay, so now what I want you to do is to hold, Michelle, you're going to hold your finger out in front of Mike, and you're going to move your finger to the side, up and down, and then across the middle, up and down, back to the middle, and up and down. And Mike, what I want you to try to do...
With my glasses still off?
You can put your glasses on if you see better with your glasses. Thank you for reminding me.
Yes, I do see better with them.
Good, then put them back on. There you are. All right, so what I want you to do is I want you to follow Michelle's finger without moving your head. So holding your chin still and
should
just moving your...
Should I keep looking straight ahead at you, or should I turn my head like this?
You should look at Michelle, and she's going to hold her finger out in front of you.
And then I'm going to go here.
And go up and down and back to the middle. Now to go the other way, Michelle, I may need you to move a little bit because I'm not going to be able to see his eyes looking to his left side. I saw the right side perfectly. Maybe you need to be on the other side of him?
I can do that. Look at my finger. Look to the left. And up. And down.
And then back to the middle, and then just up and down in the middle. Very good. Thank you for doing that, Michelle. I got a good look. Now, Mike, did that hurt at all when you were moving your eyes?
No.
Okay. Now I'm going to have you make some funny faces at me. So what I want you to do, I want you to raise your eyebrows up like you're really surprised.
Okay, glasses stay on?
Yep, they can stay on. Can you get those eyebrows up above the glasses? There you go, and I see wrinkles on both sides of your forehead. Thank you. Now look at me. Look mean and mad. Oh, that's a mad look. Good. All right, I want you to puff out your cheeks. Close your mouth and blow air into your cheeks.
Like this. So bubble out your cheeks.
There you go. There you go. You did it. Okay, now I want you to smile real big so I can see teeth. Smile real big for me. Good. Can you say Martin Luther King?
Martin Luther King.
Very good. Okay, Michelle, what I want you to do is I want you to take your fingers and you're going to put them on either side of his forehead, and I just want you to lightly stroke his forehead with your fingers, and then we're going to do his cheeks, and then we're going to do his chin. And Mike, what I want you to tell me is if it feels the same on both sides or not.
Okay.
If there's any difference. Does that feel the same on both sides?
Yes.
Okay, cheeks. Feel the same?
Yes.
Okay, now the chin.
Got that fuzz on his chin.
Yes.
Feel the same?
Same.
Good. That fuzz looks pretty good. Now, Mike, are you right-handed?
Yes.
So if you have a stroke,
The exercises we just did, originally, or a long time ago, there was a huge difference between the two sides.
okay, so immediately after your stroke, you felt a difference.
Yes.
But here we are a few weeks out from your stroke, and you've recovered the sensation in your face.
Yes, apparently.
That's helpful. Thank you for letting me know that. So this next one, Michelle, you're going to put your hand up against his cheek, and I want you to turn your head against Michelle's hand, and she's going to
Hold it.
push slightly up, and turn your head towards Michelle. There you go. And now reach across Michelle and try to do the other side. Turn against her. Good. Good. All right, now I'm going to have you face Michelle. Turn your body to face her.
When I did that just now,
Yes, sir.
I could feel it right back here when I was going like that.
Turning your head. Yeah, you might have a little bit of a nerve that's getting pinched
Well, and
then.
just when I did that, just now when I go like that, I can really feel it.
Yeah, you might have a little
Going the
tight
other way,
muscle
no,
in that shoulder.
The right.
Okay, can you twist your body towards Michelle? And then I want you to shrug your shoulders up. Yep, just go ahead and turn your torso, shrug your shoulders up. And Michelle, I want you to put your hands on his shoulders and push down. Shrug up and push. Okay, good. All right, so that completes our cranial nerve exam. It looks like you've got really good strength. Now I want to see you walk.
Do you want me to what?
Walk.
Okay.
I want to test your strength. So can you stand?
I have a hard time standing without lifting myself up from the table.
So you have to push when you stand up. Okay, so that tells me that there's some proximal muscle weakness in your legs, and we need to work on getting your legs stronger in your thighs.
I would have a hard time standing by not pushing. Even standing, I'd have to push on my knees to stand. Just.
Yep, you'd have to rock a couple of times. Yep.
Time doing that without lifting.
All right, so I want to be able to see you walk. So are you on a tablet? Is that a tablet or a laptop?
Yes.
Michelle, can you pick that up and go about 10 feet in front of Mike? And maybe flip the camera so that you can hold it up and you can see what I'm seeing. All right, Mike, can you just walk towards Michelle?
Do you want me to turn it vertically?
Yeah. Yes, that might help. Okay, now turn around and walk away.
I'm going to turn it vertically this time.
Okay. Okay, that's great. Now, can you walk heel to toe? Is that possible for
Can I
you to
walk what?
stick heel to toe? And if it's not, I don't want you to fall. No falling.
Okay.
Yeah,
Okay, that's good. That's good. Sit down for me. I don't want you to fall. That was plenty. Go ahead and sit back down in the chair.
When I walk, I have a tendency to have my feet farther apart than I used to.
Yes, and I can tell by the way you're swinging your right leg and by the way you're holding your right arm when you're walking that you're a little bit weaker on that side. But I want to test that theory out. I want you to face Michelle. And Mike, pull your chair up a little bit so I can see you in the frame, or we can twist the...
Yeah, we'll get it.
Okay, there he is. So Michelle, you're going to have 2 fingers. I want you to hold 2 fingers out. And Mike, I want you to grab her fingers with your hands.
Both of them?
Grab them. Yep. And squeeze hard.
Ow. Okay.
Squeeze. Squeeze, squeeze, squeeze.
Squeeze?
Hard.
Squeeze hard.
Oh,
Michelle,
I did.
Is he
Well,
able
then
to...
she said,
Is he able to squeeze harder on one side than the other? Is there a difference?
Not really.
no.
Okay, now you're going to hold your arms up. Strong and... Now, Michelle, grab his arms and try to pull them towards you. Pull them towards you. See if you can pull that right arm down.
The right arm
Very
is
good.
a little more giving than the left arm.
Yep. Okay, now hold them out a little bit further, Mike, and she's going to try to push them towards you. Now push those arms towards him.
And again, the right arm is
A little bit. Still a
more
little
give.
weak after that stroke.
that much.
Okay, and so Mike, I could have you squat and stand, but I can tell by the trouble that you had getting up out of the chair that you have weakness in your thigh muscles. So I'm not going to be able to test that because you've already proven that you're weak. And nor am I going to have you stand with your eyes closed. Sometimes we can have you hold your hands out and close your eyes. But because of your balance, I think it's safer not to do that test. And I think I've seen what I needed to see.
Would I flunk the test if I fell down?
That would be a total flunk, yes. No falling. That's one of our rules. No falling. So what I want now, Mike, is for you to be positioned a little bit more in front of me because there's just a couple more coordination tests that I want to do with you.
Okay.
And then we're going to finish up by testing your sensation. Michelle, if you could twist a little bit so I can see both his shoulders. So Mike, I want you to hold your hands up so that you can see your fingers in the screen. Can you see your fingers?
I'm going to leave myself out on this one so you get a better.
Yep. Okay, now I want you to play the piano with those fingers.
Then take your arms in a little bit like this.
Oh.
There you go.
Yep. Now let me see you play the piano. Bend those fingers. Play that piano fast. Good. Now I want you to take one hand and put it palm up. And this is going to be a complicated patty cake. You're going to go palm against palm, back of the hand against the palm. Okay, now just go back and forth as fast as you can. Okay, good. Now I want you to hold the other hand up. Now I know you're a little weak in this arm, but same thing, back and forth. Good, so that's checking cerebellar function, and it looks like you did a good job on that. The last thing I want to do is I want to check your sensation, and I'm really interested to see if you have any sensation on that right side of your body since you've had the stroke and still have a little bit of weakness. So Michelle, I had asked you to pick a couple of things and not show them to Mike.
Okay.
So that we could check his sensation. So Mike, to check sensation, I'm going to have you close your eyes. We're not going to stab you or poke you or hurt you in any way, okay?
Okay.
So Michelle, do you have something in your goodie bag that you can show me that you're going to put in his hand?
I've got,
Okay, so that's going to be for soft and dull. Do you have something else in there?
I have.
Good. I want you to put, I like that one.
Okay.
Why don't you put that, Mike, hold out your right hand. Can you put that in his hand? And Mike, I want you to tell me what that is.
Can I close my hand, my fingers?
Yep, you can close your hand and use all the sensation you want to feel that. You just can't use your left hand.
I think it's a bobby pin.
Okay, good. Hand that back to Michelle.
Oh, it is.
So
Okay.
Michelle, I want you to take one finger and you're going to take Mike's hand and I want you to draw a big number on his hand. And Mike, I want you to tell us what number Michelle draws.
Okay. That was a 0, I think. Zero.
Is that what you were drawing, Michelle?
No.
Wait a minute. Okay, do it again. Six.
Good, you got it. Okay, so Michelle, you had that bobby pin that was a little bit wider. Mm-hmm. Could you get that out?
Okay.
So Mike, what we're going to do is we're going to test the sensation in your hand and in your leg. So what Michelle's going to do is she's going to take this bobby pin. It won't stab you or prick you, but she's going to touch you. And I want you to tell her if she's touching you with 1 point or with 2 points of that bobby pin.
Close my eyes.
Close your eyes.
Does it matter where on the hand I do that?
Nope.
Okay.
Now what are you asking me to do?
Do you feel 1 touch or 2?
Oh. One. 2.
Did he get it, Michelle?
He got it.
Okay, good. So the hand is most sensitive. We can repeat that on the arm and on the leg to check your sensation. And so, Michelle, if you want, you can just do that after we wrap up this visit and just send me a message on the patient portal.
Okay.
And let me know how you find out his sensation is. I think that wraps it up for our exam today. Do you have any questions?
No.
Michelle, do you have any questions?
I think we're good.
All right, well, Mike, it was so good to see you again. I want to encourage you not to get frustrated. It takes a while to recover from a stroke, and I think you're well on your way.
Thank you.
Thank you very much.
All right, so I will plan on seeing you in the office in about 2 months. Does that sound okay with you?
Sure.
Sounds good.
You can contact us via the patient portal at any time, or you can call. We have doctors on call 24 hours a day, 7 days a week. So just call the office if you have any questions or concerns.
Okay.
All right.
All right.
Thank you.
Yeah, take care. Bye-bye.